Good afternoon, this is Dr. McDaniel. Today is Friday, May 3rd, 2019, and I'm continuing on the answer to a viewer question that was placed Wednesday. I started most of it yesterday. Hopefully I'm going to finish it today. I think I should. And the question was, basically, this lady is 51 years old and she's going through menopause, and she wanted to know if it was normal or common to have heavy menstrual cycles, heavy with clots, while she's going through menopause, because obviously most of us know that one skips the cycles when they're going through menopause. So I discussed yesterday how I had a patient who had the same issue, that she's going through menopause and was usually having light short cycles and skipping months at a time. And then when she came in on Wednesday, she'd had heavy bleeding for several days with large clots. So I discussed in yesterday's presentation that when one goes through menopause, it's the same as when one starts getting their menses. So at between 9 years old and 16 years old, most girls will start their menstrual cycle. That's the normal range, and we call that an anovulatory time, because irregular ovulation pattern is very common and it's considered normal between that time frame and up to 2 years after a young girl has first started getting her menstrual cycle. That's fair game. It's also fair game and normal to have anovulatory cycles or irregular ovulation patterns when one is finishing getting the menstrual cycle, so at menopause. Predominantly, an anovulatory cycle will cause irregular skip cycles or super light spotty or just brown smudgy, which we call staining. That can happen for a year, 2 years, even up to 5 years before the cycle. What we will always do, or I should say predominantly do, is just check to make sure that the skipped or irregular cycles are really due to menopausal changes, not to other medical concerns. So pituitary brain or prolactin levels, and thyroid functioning tests, TFTs, and thyroid stimulating hormone or screening test for thyroid is usually done simply to confirm that there isn't a medical condition that we're assuming was going on, but we're assuming it was due to menopausal changes. If the menopausal hormones, if those hormones are consistent with menopause, and that lady has gotten her cycle within the most recent 12 months, then we say she is perimenopausal. We don't say someone is menopausal unless they haven't had the cycle for a full 12 months in the face of either menopausal symptoms and or the hormones that confirm she's menopausal. Now, that being said, we obviously don't have a treatment for menopause, because menopause is when we stop getting cycles because we're no longer fertile and producing eggs that are fertilizable. We do treat the symptoms. So the most common symptoms of menopause are emotional symptoms. So moody, irritable, depressed, anxiety, depression, angry, cry easily, also decreased libido, sex drive, skin changes, skin dryness, vaginal changes, vaginal dryness, hair changes, hair dryness or loss of hair. They're also most recognizable are hot flushes and sweats. So those symptoms, we treat the symptoms. We can't treat the change, which is menopause. And for the cycle irregularities, we can also treat those symptoms. So skipped cycles, random cycles, spotty, smudgy, staining cycles, but also heavy cycles, because anovulatory changes can potentially produce an abnormal buildup and then allow for an abnormal flow. So heavy cycles with clots, either golf ball sized clots or even fist sized clots for some women, is common. We will always evaluate, or should always evaluate, with an ultrasound or a sonogram if the cycles are heavy, long more than 7 days or with the clots, and an ultrasound or a sonogram is done to confirm that the tissue inside the lining of the uterus is normal. That lining should be 5 millimeters or less, and that there aren't any abnormal masses, growths, fluid collection, so fibroids, polyps, or tissue abnormality or distribution that's potentially the source of abnormal bleeding. Heavy, long cycles during the perimenopausal time frame. If the ultrasound or the sonogram is normal, then we can treat irregular bleeding symptoms. And the treatment for those symptoms is always going to be birth control pills, what we call low-dose monophasic pills. So the dosage is either 10 mics or 20 mics of estrogen. Those, and monophasic means that the hormone levels stay the same level all month. They don't fluctuate or change. So we treat those symptoms with birth control pills because our treatment for hormonal problems is hormones, and the only hormones we have during the reproductive and perimenopausal time frame are birth control pills. First off, obviously they're for contraception or to prevent pregnancy, but they have benefits, and those benefits are suppression or manipulation of hormone-related signs and symptoms. So the low-dose monophasic birth control pills will predominantly, within 1 to 3 months of starting the pills, suppress all of those menopausal symptoms and signs that I stated earlier. They will also, ideally the first to 3 months, but predominantly after the initial 3 months, they will treat or manage the cycle itself. So they'll give regular, predictable cycles every month, once a month during the 4th week or the placebo week. And for some women, they will stop the cycles altogether because they're very low dose, they're non-stimulating. So for some women, after the initial 6 months, they may not get cycles at all, or they may just get 1 to 2 day cycles, very, very light. As long as one takes those birth control pills or the low-dose monophasic pills every day at the same time frame, they will give regular, predictable cycles every 4 weeks. Most women will get 2 to 3 day cycles and light. Every once in a while, someone says they're 4 to 5 days, and about 20 to 25% of women will not get cycles at all. They'll stop getting cycles altogether. The pills are the best because they're the easiest to manipulate. After the birth control pills, one can do the hormonal IUD. That's the progesterone hormonal IUD. They have a whole bunch of those now. So the Mirena, Kyleena, Liletta, Skyla. I think those are all of them, yes. So the hormonal IUD, because what it does is it prevents, the progesterone on the IUD is an attempt to prevent or decrease or reduce the amount of bleeding or tissue that builds up in the uterus by the body's own estrogen levels. So if you decrease the amount that builds up, you decrease the amount that flows. The catch with the hormonal IUD is because it's just progesterone and we're relying on how your body responds to that progesterone influence on the uterine lining, one may not get results very quickly. It may take 6 months before the cycle is either shut down or reduced. It also won't help the hormonal symptoms, so hot flushes or sweats, thank you, emotional, all of the different hormonal symptoms that can occur. After the hormonal IUD, the next best thing would be either the shots, but they're going to have the same response and the same time frame as the IUD. There's only one shot, that's the Depo-Provera. Or if someone can't take the birth control pills because even that low level of estrogen is contraindicated for medical conditions, so those would be like a history of a stroke in the past, a history of deep vein thrombosis, history of pulmonary embolism, a history of migraines with aura or ocular migraines, uncontrolled diabetes or a history of vascular disease, history of cardiovascular disease or heart attacks in the past, or uncontrolled hypertension. So if someone can't take estrogen at all, even the very, very low doses that we have in the low dose monophasic pills, then the mini pill or the progesterone only pill is another option. Those are really all the options. Those options are given, so the regular low dose monophasic pills, the hormonal IUD, the shots, or the progesterone only pills, the mini pills, those can be given or maintained up through on average 55 to 56 to suppress and to ameliorate those perimenopausal symptoms. What we will usually do is either during the 4th week of the pills, that menstrual week or the placebo week, we'll draw your bloods twice 6 months apart to see if they're consistently menopausal, and if you haven't had cycles or the cycles are very, very light, very, very teensy weensy, just a brown smudgy or something, then and you're between 55 and 57, we'll usually stop the pills, stop the shots, or remove the IUD because the benefits should have been reached. You should be menopausal. As I mentioned, the IUD is the only one that will help the cycle problem, but it won't help all of the other menopausal symptoms. The shots will help for the most part, not as well as the pills will. The pills are going to be the best. Once someone's gone through menopause, then they can either just see how they do on their own, because obviously they shouldn't get cycles anymore since they're menopausal, or if they're still having hot flushes and sweats, then any of the homeopathic remedies or the hormone replacement is going to be the option to manage those symptoms. So I hope that's been helpful on the question of abnormal bleeding during the perimenopausal time frame. This is Dr. McDaniel on GYN Corner. It's Friday, May 3rd. Thank you for watching. Everyone have a great weekend. See you tomorrow.